My name is Danielle Carreri, and this is my presentation on incorporating sign language into ABA sessions with clients that have limited speech abilities or hearing impairments. So I'm going to be going over the common language development patterns in clients with autism, American Sign Language, challenges the client and their families may experience, the research presented, implementing procedures from that research, and just a quick conclusion. So we're just going to jump right into it. As we know, verbal and nonverbal communication, um, if you're weak in this area, this could lead to difficulties expressing those wants and needs, forming a relationship, engaging with the environment around you. Um, right now, it is the delayed language onset is about a 30-month difference from typical peers. That's about 2.5 years later, um, which we know this could really affect long-term communication, independence, social engagement. Um, there was a study by Fuller and Kaiser 2020 that found early interventions focused on social communication to greatly improve the child's ability to initiate and respond during interactions. They did consider these skills as a critical behavioral cusp. Um, so, opening up access to new learning and social opportunities. You could also see that receptive targets are a little bit stronger than expressive targets typically in kids with autism, but some kiddos can struggle with both of those targets. So I'll later present that sign language can help with that. And also commonly found in language development is atypical language features, so echolalia, jargon, unusual prosody, which is when you test your kiddo if they can imitate how fast or slow you're saying a syllable or emphasizing on certain syllables, and intonation, which is the fall and rise of a voice pitch during speech, so high pitch or low pitch through there. So American Sign Language is actually considered a augmentative and alternative communication (AAC), which is a evidence-based practice. It also can function as functional communication. It's a visual support, and it could be either simplified for your learner, or you can use approximations that your learner is using or how they communicate through there. It doesn't have to be perfect, but we're just looking to give them an outlet to communicate. Um, so sign language, like I said, will offer a visual. It is an accessible mode of expression, and this can really bridge the communication gap between learners that have um, weaker verbal behavior through there. So some challenges that the client may face in school or community settings, like I said before, expressing those wants and needs, especially in the community, self-advocacy through there, following instructions, peer interactions. These are all um, typically um, more, they hold a higher priority in behavior plans because the parents usually want to push for these type of challenges that they're observing through school and home. And also the challenges for their families back at home. This can really put an economic and employment challenge for the family through there. Sometimes therapy can cost a lot of money, or a parent needs to either cut their hours or stop working entirely to care for their child with autism. Social interactions can be another big one, community outings, and also the uncontrollable feelings. I mean, this is a little bit more mentalistic, but those feelings of frustration, stress, hopelessness, um, it could be a real journey, especially for the siblings as well. At such a young age, they can be confused, they can feel left out, they can feel angry. So it's important to note all those challenges. So we're going to jump right into the seminal study of sign language and autism, which was posted in 1981. They examined the use of sign language as a communication method where the population was about 3 years old to 23 years old. The findings support that ASL was a developmentally appropriate communication method for children with autism, especially those who were minimally verbal. They actually also proved improvements extended beyond what they were targeting. So the children started generalizing to 2 and 3 word phrases using sign language and implementing that adaptive behavior and seeing a better overall social communication. They were incorporating signs and phrases for I want, I need, that type of situation. Here's some more research here where all these studies are single subject designs. They both include male and female participants that have an autism diagnosis. Throughout all the studies, there's varying levels of communication. The first study, Carr et al., there's 20 participants. The second one, Layton, there's 16 participants. And Yoder and Layton had 60 participants, so there was no small n here. So actually the first two studies to the left, Carr and Layton, they're comparing speech versus sign or together, presenting following instructions or intraverbals. So both of them were looking at the same thing. The Carr et al. Study was only looking at speech versus sign, and Layton was looking at 4 different types. So it was sign, speech, sign and speech together, or another method of communication. The Layton study was participants were at 3 to 9 years old. They really proved that the idea of sign language, whether used alone or together with speech, can be really powerful. And the last study presented here, they were actually trying to prove that that there was a myth that alternative communication methods can delay speech, vocal words, and they proved that it did not. They actually had several children begin to produce spoken words corresponding to the signs that they learned. So this did not hinder speech, but instead supported and encouraged its development. So this is just proving that AAC devices also could be a really great alternative to this population, especially for the minimally verbal children who will benefit from visual and motor-based strategies. Okay, so now we're going to go right into if we were going to implement this with our clients in vivo. So you want to have some kind of core ASL communication skills, whether it's individualized for your client to use those signs, or if you're looking for more universal signs like help, thank you, more, all done. You also should be able to speak your words and sign with the parent sign, I guess. Differential reinforcement was also mentioned in the studies, and I found that implementing discrete child training is one of the best ways, one of the best interventions to teach this. It's important that we're going to teach receptive identification of these signs first rather than expressive. All right, some teaching strategy. So limited communication repertoires did show higher results with the utilization of ASL or total communication training, which is using multiple or possibly all forms of language, so signing and speaking at the same time. And as I said, discrete trial teaching is recommended, and I'm going to go over a new procedure that I came across, enhanced milieu teaching. Okay, so for DTT, along with various differential reinforcement and correction procedures, you're incorporating gestures or signs, you're modeling these responses. We're going to be prompt fading these procedures and prompt fading the prompts through there. Right. You typically, if you're starting off with these signs and we have younger learners, we're going to start with manding. That's always the most reinforcing, starting with break, help, more, eat. We want to establish receptive targets first, so asking your child, do you want a break or help, while modeling those signs. And then they could either respond verbally, sign, AAC device, they could point, something along those lines. It may seem like a lot of prompting at first, but of course, like I said, you're going to prompt fade through there. How do you do it? Systematically, of course, depends on your learner. As the client progresses, the modeling will fade. More indirect prompts can be used, which would be kind of natural through there. Typically, if you're out in the community or with a teacher or a parent, they will ask you questions like, what did you need? How can I help you? Things like that. So teaching those targets through there. And you could also build in those expressive targets as the client progresses. Okay, so this was pretty cool that I learned about this enhanced milieu teaching. EMT. Milieu is actually French for setting or environment. I've seen this used in, I think, like government or military milieu. So pretty much what it is, it's typically used to teach young children how to request for their needs using the environment around them. So enhanced setting teaching, pretty much, sound familiar? Kind of is a more narrowed section of NET, natural environment teaching. I found that this is used not just for individuals with autism, but that have an autism diagnosis, but clients that are nonverbal, they have apraxia, and they're incorporating the prompting, manned modeling. Like I was saying with the receptive targets, when you ask them, do you want a break? You want to show them visually a break, or do you want help? You're going to show them visually the sign for help so they can pair it through their reinforcement. Environmental arrangement in the natural setting, and they do use a lot of open-ended and choice questions, like I was just explaining, and they are using time delay procedures. So since we're typically using this procedure during NET, it's easier to incorporate into play or daily routines, which is really great for parents and teachers. Having those natural conversations to teach language. You want to use language that is connected to what the child is doing. So like I said, the open-ended questions of what are we going to play with next? And have them be able to explain what they want to you. You also don't want to like always give them the words. You're kind of prompting them through there. If you always say, do you want dinosaur or train tracks? You could say indirect things like, I wonder what we're going to play with next. So you're not always prompting and giving those choice questions. So yeah, these are more natural modeling, time delay procedures through there. Your prompt hierarchy will depend on your client's learning patterns, of course. So that would be either least to most or most to least, whatever your learner is going to be most make the most progress in. So why should you know this? Why did I just go over all this for you? I also came across some studies that the prevalence of characteristics of deaf and hard of hearing children are actually much higher than previously recognized. Um, it is also just higher than other um, disabilities through there. So this was just interesting to learn that just from these three different studies, they were different factors in there. So they are kind of a little bit spread out, but that was the average through there. About 2% to about 9% was on the high end. Also, the point is that Scott and Hansen 2022 did a study that 70% of the school district did not have formal training to work with a dual diagnosis of ASD and deaf or hard of hearing children. And 85% of those 85% of those teachers did vote yes for additional professional development. But as you know, that sometimes takes time, it costs money. I mean, as graduate students, you can help bridge that gap and step in. There's also a lack of assessments and clinical experts for this particular population, so it's important to touch base on that. So I hope you enjoyed my presentation. I hope this was insightful for you, and how I went over the delayed language onset and how the dual diagnoses is actually higher than expected. Children with limited verbal skills and deaf of hard of hearing children can benefit from sign and gestural verbal behavior. And don't forget to use total communication training, DTT, EMT, NET, and differential enforcement. Here are my references. Here is another page of references. And I hope you have a great rest of your semester. Thanks.